Hello and welcome. Today, we'll be discussing bladder foreign bodies, a condition that can cause significant discomfort and complications. We'll explore what they are, how they get there, the symptoms they cause, and the available treatment options. Bladder foreign bodies are objects that are not normally found within the urinary bladder. The ways these objects can end up in the bladder are varied. Iatrogenic causes are common, meaning they are introduced during medical procedures, such as catheterization, cystoscopy, or surgery. Fragments of sutures, surgical instruments, or even pieces of catheters can inadvertently be left behind. Self-insertion is another cause, often associated with sexual curiosity, psychiatric conditions, or attempts to relieve urinary symptoms. These objects can range from beads and wires to pens and other household items. Less frequently, foreign bodies can migrate from nearby organs, like the bowel, due to fistulas or erosions. Finally, projectiles entering the body through traumatic injuries might end up in the bladder. Once a foreign body is present in the bladder, it triggers a cascade of events. The bladder lining, or mucosa, becomes irritated and inflamed. This inflammation can lead to the formation of bladder stones, as minerals in the urine precipitate and accumulate around the foreign object, acting as a nidus. The presence of the foreign body and any associated stones the risk of bacterial infection, leading to cystitis or potentially more serious upper urinary tract infections like pyelonephritis if the infection ascends. Chronic irritation and inflammation can eventually cause bladder wall thickening, decreased bladder capacity, and even ulceration or perforation in severe cases. The exact prevalence of bladder foreign bodies is difficult to determine due to underreporting and the varied causes. They are generally considered uncommon. However, they are more frequently seen in certain populations. Individuals with indwelling catheters, those who have undergone urological procedures, and patients with psychiatric disorders are at higher risk. Self-insertion is reported more commonly in males than females. While bladder foreign bodies can occur at any age, the incidence tends to increase in older adults, particularly those with age-related urinary issues or cognitive impairment. The geographic distribution of this condition doesn't significantly play a role. The symptoms of bladder foreign bodies can vary depending on the size, shape, and material of the object, as well as the duration it has been present. Some individuals may be asymptomatic, especially if the object is small and non-irritating. However, more commonly, patients experience urinary frequency and urgency. A persistent need to urinate more often than usual. Dysuria or painful urination is another frequent symptom. Hematuria, or blood in the urine, may also occur due to irritation of the bladder lining. Other symptoms may include suprapubic pain, lower abdominal discomfort, recurrent urinary tract infections, and difficulty urinating or urinary retention in severe cases. In cases where bladder stones have formed around the foreign body, patients may also experience symptoms related to the bladder stones themselves, such as flank pain if stones migrate towards the kidneys. Diagnosing bladder foreign bodies usually involves a combination of medical history, physical examination, and imaging studies. A detailed medical history is crucial to identify potential risk factors, such as previous urological procedures or psychiatric conditions. A physical examination may reveal suprapubic tenderness. Urinalysis is performed to detect the presence of blood, white blood cells, or bacteria indicating infection. Imaging studies are essential for confirming the diagnosis. A plain abdominal X-ray can visualize radiopaque objects, such as metallic objects or calcified stones. Ultrasound can detect radiolucent objects and assess bladder wall thickening. However, cystoscopy, a procedure where a small camera is inserted into the bladder, is often considered the gold standard for diagnosis. It allows direct visualization of the foreign body, assessment of the bladder lining, and, in some cases, retrieval of the object. While there isn't a formal classification system for bladder foreign bodies, they can be categorized based on their origin and composition. As previously discussed, they can be classified based on their origin, such as iatrogenic, self-inserted, or migratory. Based on composition, they can be classified as radiopaque, meaning they are visible on X-ray, or radiolucent, meaning they are not. Common radiopaque materials include metal, glass, and calcified stones. Radiolucent materials include plastic, wood, and certain types of rubber. Understanding the composition of the foreign body can help guide the appropriate retrieval method. The primary goal of treatment is to remove the foreign body from the bladder while minimizing trauma to the urinary tract. The method of removal depends on the size, shape, composition, and location of the object. Small, easily accessible objects may be removed cystoscopically using grasping instruments. Larger or more irregularly shaped objects may require fragmentation before removal, which can be achieved using lithotripsy, a technique that uses shock waves to break the object into smaller pieces. In some cases, open surgical removal may be necessary, especially if the object is deeply embedded in the bladder wall or if there are associated complications, such as bladder perforation. If infection is present, antibiotics are administered to treat cystitis or other urinary tract infections. Following removal, a follow-up cystoscopy or imaging study may be performed to ensure complete removal and to assess for any complications. Bladder irrigation may also be used to help remove any remaining debris. Preventing bladder foreign bodies involves addressing the underlying causes. Careful surgical technique and meticulous attention to detail during urological procedures can minimize the risk of iatrogenic foreign bodies. Thorough questioning and exploration of self-inserted items should be performed to identify at-risk populations. Proper management of indwelling catheters, including regular assessment and timely removal, can prevent catheter-related complications. Education and counseling can be beneficial for individuals with psychiatric conditions or those engaging in self-insertion behaviors. Promoting safe sexual practices and discouraging the insertion of foreign objects into the urethra can also help prevent this condition. The prognosis for bladder foreign bodies is generally good with prompt diagnosis and appropriate treatment. Most patients experience complete resolution of symptoms after the foreign body is removed and any associated infection is treated. However, complications, such as bladder perforation or chronic inflammation, can occur if the condition is left untreated or if the removal is difficult. Recent research has focused on developing less invasive techniques for foreign body removal, such as the use of flexible cystoscopes and advanced lithotripsy methods. There's also ongoing research in using biodegradable materials for catheters and surgical instruments to reduce the risk of iatrogenic foreign bodies. Additionally, psychological interventions are being studied to help individuals who engage in self-insertion behaviors.